I can't
That's
ever say enough good things
I
about
love that.
Midland, and that's actually when I worked for a different organization. They made me the closer because we recruited a lot of people outside of the area, and I could sit and tell people my story and just say, I left and I came back. I mean, I moved across the country twice in 18 months, and that second time around, I was pregnant. Like, that's not fun.
Yeah.
But to want to come back here and to raise my family, I just couldn't imagine raising my family anywhere else.
Yeah. Jackie, thanks for being with us today.
Of course.
So Leslie Crisp is also with us. She's with Every Neighbor. And we are just here to learn about Midland Health and what you're doing in the community. So you're the director of auxiliary services. So tell us what that even means.
Yes.
Because honestly, auxiliary is to me kind of an older word. And so tell us a little bit about that word, how it came about, and who you are.
Yeah, of course. So I would say that my position it's two facing. So I oversee all of the volunteers that come through at the hospitals. So back in the day, they were mainly called like the candy stripers. Today we call them the pink ladies, or I like to call our men the men in blue. So we have adult volunteers that I oversee, and then in the summertime we have our junior volunteers, and then so that's one part of it. Then the other part of my position is overseeing the business that the auxiliary owns. So the auxiliary is its own standalone nonprofit that was created to solely support the hospital. So we have two gift shops. So I oversee all the operations of the gift shop with the buying of the products that go in there, running the point of sale system, making sure that the day-to-day operations are flowing. So I oversee all of our volunteers, make sure that we're recruiting, maintaining, and then also I'm over the operations of our two gift shops at main campus, and then we have one at West Campus.
Wow. So you're a mom
I am.
full time. That was a
Yes.
lot.
Yes.
So let's backtrack a little bit. Tell us, with the auxiliary, I know that you just celebrated an anniversary.
hmm
What year was that?
So we celebrated our 75th anniversary. So we were created in 1950.
1950.
Yes.
And what was the idea behind it? Can you tell us a little bit about how that happened? That somebody said, "Hey,
Yeah.
we've got to create this," and then tell us a little bit about that word.
So volunteering back then had a lot more responsibilities than today. So
Okay.
if you look at our history, they were asked to administer patients shots, clean bedpans. They're very thankful I don't ask them to do that today. They're like, nope, we're out on that. It was very much when the hospital was being established in Midland that a group, along with like the founders of the hospital, there was also a community group of volunteers that wanted to pitch in however was necessary. So they formed the auxiliary and really were doing anything that was needed to be done around the hospital just as an extra set of hands. As we have evolved and the world has evolved and there's lots more regulations
And
now.
thank God it has.
Right, absolutely. I'm so glad. Now our main purpose is to serve our patients and visitors and staff in a different way, but still a very important way. I have volunteers that you'll see at the entrance of the hospital, and they're really there to help navigate patients. If you've ever been to the hospital, it can very easily become a very winding, confusing place because there's lots of different avenues that you can take to get to certain places. So to have a volunteer there, it's really the frontline customer service that we can provide to the public, that it's like, hey, you have a buddy now. You're not going to get lost on your own. We can send a volunteer with you to help navigate where you need to go. They're just that extra support system. If someone comes in and needs medical records, my volunteers know how to get on the phone, get those called up and brought to the person. It's just that extra layer of support that maybe a staff member is busy doing something else, but my team can step in to help. So we've evolved from, bedpans and administering shots to let's walk you to where you need to go, because that's just that extra service that really helps alleviate the stress. Because usually when you're at the hospital, you're there for a stressful reason, unless you're there to have a baby, and that's really the most exciting part of being at a hospital. Otherwise, you might be going through something. So just having that friendly face that you're like, oh, I can trust this person, they can help me navigate. We get that feedback a lot, that they're just happy that they have that support system there to help them.
Absolutely. I love that. So you're a little bit multi-generational.
Mhm.
I mean, because you mentioned that you have junior volunteers. And then I know just, I believe when we've talked in the past, you've talked about just having older volunteers as well. So describe some of the people that volunteer with you,
Mhm.
what it looks like. It's certainly not as scary as it used to be. So thank you for alleviating some of that fear.
Mhm.
But what does it look like for a volunteer to of any age to come in and serve with the hospital?
That's yeah, great question because it's fun. Being in my position is really fun because I do get to work with people of all ages across the board. So my youngest volunteers are 14. So you have to be 14 before you can start volunteering with us. I love the kids in their own sense because they're these moldable humans that come in and they're so fresh to life that they don't know and they just trust everything you say. So when I they're working in the gift shop, we'll teach them how to run a register or answer a phone, and we go through steps. Like they'll answer the phone the first time, they're like, "Oh, some so and so called for you." And I'm like, "Well, what did they want?" They're like, "Well, I don't know." So then we go through the whole training of, "Well, next time, write down the purpose and like a callback number so I can, return the call." So they're getting those life skills. Where then later on they'll call and they're like, "Hey, I'm applying for my first job. Can you be my reference? It's at a retail store." Well, they've gained all that experience in customer service through working with us. So there's that. And then also they just get to be around the medical world because a lot of the juniors that we get are like, "Oh, I want to be a doctor or a nurse." And so even though they're not necessarily out on the floor, they get to see the environment of a hospital because it's almost like we're our own little city. Everyone has their little key part that they play within the hospital. So they get to be in that atmosphere and really learning, like, oh, these are the functioning parts of a hospital. So that would be my youngest group, and they're fun in their own way. Then I have a few moms that have kids that are older and they come to me, they're like, "My kids don't need me anymore. They need me for like to drive them around and that's it," which I know that'll be my life soon enough. But they come to me, they're like, "I need to do something with my day." So they're great because they love to go up front and they use that as their exercise for the day because any given day we get 1,000 people through the door. On average is 1,000 people, and so they'll walk on a busy day 5 miles just all around the hospital. So it's great because you're getting in your steps, you're serving the community, and it's fun.
So 5 miles is about 10,000.
Yes,
Yeah.
and I've
Okay.
had some that come in at,
Reach your
like,
goal.
an hour into their shift, and they're like, "Oh, I'm at 9,000 steps." So, it just depends on how busy the days are. So they're great in that way, so I have, like, those types of I have college students as well. So, our college students come in because they're already in their classes, and they're like, "I need volunteer hours." They might be going into the medical field or something else. So, at first, it might be where they come to me, they're like, "Oh, I just need my volunteer hours." But then they see how fun we are, and then they're like, "Oh, I've reached my goal, but can I keep coming?" And I'm like, "Absolutely." And so we have fun little projects that they do as well. I think it's a lot of times it is girls. I don't have a large male volunteer population, but the girls like find working in the gift shop really fun because we teach them how to merchandise and how to set the floor and all that. And so that's been really fun with my college students. Um, then I do have my older population who I learn a ton from. Um, I value them so much because in their season of life, they are not afraid to push back and say, "Well, why are you doing this?" And they're the ones that push me to better myself because they're like, "Well, they don't just say yes."
Mhm.
They're like, "Well, why would you do that?" And then you have to talk through it and then you're like, "Oh, I never thought of that." And so I think my oldest volunteer now, I think she just turned 86.
Wow.
So we range from 14 to 86 and I get a great front row seat to watch everyone through their phases of life. So, it's
I
fun.
love
A quick question based on 14-year-olds answering the telephone. So I've seen some really funny things on Instagram where a phone rings and these kids, they don't even know what it is. They don't know how it works. They don't know how to use it or how to dial it. Have you had any funny stories on these young kids not knowing how to use anything but a cell phone?
So we haven't run into that. I have had them where like they think it's funny that we have like just normal books that we sell. They're like, "Oh, people like come in and buy these." Like that's kind of weird because I feel like now everything's digital. Like you
Right.
don't really get your paperback book anymore. They find that kind of stuff funny. There some of the terms that and I feel like I'm not that old, but man, does a 14-year-old make me feel old. Like some of the terms or I'll be talking about, they're like, "We have no idea what you're talking about." But they come in handy because half the time I don't know how to do something on my cell phone and they're like, "Oh, let me show you." And then they just go on my phone and they fix it for me. And then I in turn am like, "Oh," to my older volunteers, I'm like, "Oh, look what they taught me." So I feel like it's generational is like they know their strong suits. They kind of giggle at some of the stuff. They're like, "No one does that." Or some of the words we say, they're like, "That's not cool." But I do have a strict policy while they are volunteering with me that they can't be on their cell phones. So I learned very quickly my first summer to I was lenient. It was my first rodeo, and I may have put too much trust in kids to like maybe not be on their cell phones. So now they know, like some of them know that they can't stay off of it. So they're just like, Miss Jackie, I'm gonna just put this in your office for my shift.
Good.
Because they know it's too much of a temptation. So I haven't ran into where they see anything where like, oh, I don't know what that is. But my first summer that I was there, we had this very back in the day register that we used in the I didn't even know some of the stuff. Or when the ladies got out, I see I'm gonna just say it myself. I didn't know what this calculator thing was that they were using. And I was like, well, we just have our phones, but it was like one that had the receipt on it.
Oh, yeah.
And like we needed to trade out the paper and I was like, well, I don't know how to do this. Like I don't even know what this is. Or I love it when someone calls me, they're like, can you fax this to me? And I was like, so I don't know anyone that has a fax. And I'm sure there's people in the hospital, obviously, that have fax machines, but I don't know how to do a fax. So I would say we've ran into more things with me than the teenagers where I'm like, well, I don't know how to send a fax because I could just scan it to you through email.
Yeah,
So
Right.
it's more
exactly.
me. It's
Exactly.
has the challenges than the kids.
That's good. Well, I love it that you guys are investing in multi-generational. I think all of us can learn from that. You can see the younger students being able to see older people in the population serve and give back. And then you have the older women who are investing in younger people,
Mhm.
and just that interaction I think is so important. So I love that you guys do that, and provide those opportunities for students and older generation, because I
Mhm.
think sometimes, I mean, I see it in family members and things like that. We wonder, when you get to a certain age, how can you continue to give back, or is there a
Mhm.
job for me? And so in retirement or whatever that looks like. And so I love it that people can really invest back in the community. So tell me a little bit about just when I'm volunteering, what that looks like in a day. Um, Other than greeting people, tell us about you just came in and you talked about popcorn. And so tell us a little bit about the popcorn
Yeah,
that
absolutely.
fundraising, I guess.
It is. So our popcorn, we have people that will come specifically to the hospital to get popcorn. So they are there just to come buy our popcorn, which we love, because it is we call it the famous popcorn. And I send it through the vents so that people smell when we start cooking it and they come.
That's a
Um,
really good idea.
so our popcorn is donated by C&B in town. So they do all of our popcorn for us, all of our bags. So it's a great fundraiser for us because it's 100% profit and it's how we're able to keep our prices so low. So a lot of times people are like, this is only 25 cents. So you can get a small bag for 25 cents. And then our biggest bag is $2. So people love that it's still an old school price and they're getting quality goods. I've noticed recently the popcorn sales have really gone up. So typically we're doing, maybe $40 a day. Well, lately we've been doing over $100 a day. So last year we sold, I think it was 17,000 bags of popcorn, which was about $15,000 profit for us. So it's a great way for us to be able to give back to the hospital because of that partnership with CNB donating that. And everyone loves it. It sometimes, we have to have the popcorn machine go out for maintenance, or there's been supply issues getting the popcorn. It's chaos. Like people are like, "Where's the popcorn?" There are a few staples at the hospital, and popcorn is one, and we have to make sure we don't run out of popcorn or pickles in the gift shop.
Like
I found that out. They want their pickles and they want their popcorn.
popcorn.
So
It's good.
yeah.
So tell us a little bit about where that money goes, because I know that just through the volunteering and through the gift shop,
Mhm.
tell us what you've been able to provide just with gifts to the hospital, to certain departments. Where does that money go?
So most recently, we had the labor and delivery department come to us and they have a mannequin that they use. It's a simulating mannequin that actually simulates birth and the mannequin gives birth. It's wild. I highly encourage anyone to take a tour. So Noelle was her name. She maxed out at, I think it was a little over 1,000 births, and they had to retire her because there was no reviving Noelle. So they came to us and they said, we really need to get a new mannequin. They introduced us to baby Paul, who's there, and how they can really do lifelike scenarios on these mannequins. I mean, these mannequins talk. It's kind of creepy. But also very fascinating. And so they went through the whole process of how they teach nurses in other departments and how it is really changing patient care, that they can simulate these live events for them and then go have teachers, preceptors watching and then go
Mhm.
in and correct them before they even get into the actual patient care. So it's been a huge game changer. So absolutely we wanted to support that. So we were able to purchase a new mannequin, and then they said, "Well, do you all want to name it?" And of course my board was like, "Absolutely." And then they did the honor of naming it Mama Jackie. A little bit embarrassing, but you know what? I was a good sport about it.
Hey, that's an honor.
Yeah, it was like, "Sure, if that's what we wanna call it." They're like, "Yes, that's what we're calling it." So, Mama Jackie is set to be here in June, and so then my board will follow up with a, reveal and how this all works, but our simulating center and everything they do is just amazing and top notch, and we were very happy to be able to supply something that they needed. So, we were able to do that through fundraising. We were able to give the hospital our biggest single gift to date. We were able to give them a $500,000 pledge towards the new building project. We've never been able to give a single donation of 500,000. So that was a huge monumental moment for us. And to be able to do it at our 75th celebration just really was like the cherry on top. It was great. So we do that. We have other departments that'll come to us. We bought the wheelchairs that were needed. They came and said, we really need wheelchairs over at West Campus too. So we're able to purchase all of those. When the wheelchairs need to be fixed, we're able to buy those supplies where our clinical engineering guys can go in and fix all of that. So we really wait for the hospital to tell us what they need. And then if it's something that wasn't necessarily budgeted, we're able to come in and say, "Oh, well, we can buy that for you." And then the ladies are always looking for special projects to do. The hospital's taken it on an initiative to help support the homeless population and what we can supply them throughout the year. So this month it was toothpaste and toothbrushes. So all the volunteers, it's in my office. There's a whole big box of toothbrushes and toothpaste that then we'll go and donate. So we're always looking to see what the hospital needs or what the hospital is doing out in the community and how we can help support those types of things.
That's awesome. I love that. I love it because it's very tangible. It's, a lot of times people in the community, they wonder where they can give. Um, they want to vet
Mhm.
an operation or an organization, but I love that what you do, it's fun. I mean, the
It is
volunteer
fun.
piece is absolutely
Yes.
fun. But then just going to the gift shop, if you need something, realizing that those dollars are really going to support other good causes
Mhm.
within the system and to
And we've
support
really
other
seen
people.
the staff rally behind us too over the last couple of years. We listen, what do you want? What are you looking for? Because we are there for a convenience for patients and family, but I would say our customers are 80% the employees. So what are you looking for? So we just started our t-shirts that we're selling that have been a phenomenal hit that we just kind of shot in the dark. Maybe they'll want to buy these, but it's really brought the whole hospital together because it doesn't matter if you're a nurse, you're in the kitchen, you're
Uh-huh.
me, we're all wearing matching shirts. So it's kind of like we're all one tribe now wearing the same shirt. We have holiday editions. Those have been a huge fundraiser for us where the staff is just they're really on board and understand that when they come and shop with us, it's all going back to where we all work and serve and love. So
That's great.
You had mentioned in a previous meeting that we had with you, and I don't remember if you called it the Christmas market,
Mhm.
but where you brought in a lot of vendors
Yes.
and people so that the staff who works diligently and don't have the time necessarily to get all their Christmas shopping done. Tell us a little bit about that.
Yes, so those are our employee vendor markets that we do. So what those are, um they had been going on prior to me taking on this position, but it had been more bringing in outside vendors from like Las Vegas that sell like perfumes, electronics. And then I was thinking one day I was like, well, why couldn't we just use local people and use that same process? Now, these big companies, that's what they exist for, is to come to a hospital and do payroll deduction. So I took that model and I just rolled it out to local businesses. So it was really hard to recruit people locally to come sell at the hospital because at first they're like, it's the hospital. Do people go shopping? And I was like, I'm telling you, don't underestimate how much shopping our employees will do. I see it in the gift shop every day. So our first market, we just tried a couple. And we sold out. We had a candle vendor. We sold her out by noon on the first day. She had to go home and start making new candles. We had a local artist that makes door hangers, sold him pretty much out by the end of the first day. So I kind of figured we were onto something. So the first market was small, and then they've just grown and grown and grown to this last Christmas market that we did. We had 21 vendors throughout a 2-week period rotate in and out of the front lobby, and we were able to do $178,000 in sales for local vendors. And then that turns around and that gives us a commission back. So to be in one of our markets, you agree to give back commission to the hospital. All of last year, we were able to do, I think it was around like 400,000 in total sales through these markets, which is phenomenal. And 200 of that was through local vendors. So one of the most rewarding things through my job is getting to make these connections with these local vendors and saying, this has impacted my life so much. Thank you so much for allowing us to come and sell to the hospital. Which really, like, I'm thinking, well, no, thank you, because you're selling so much that then we're making so much money for the hospital. So it's a really great partnership because even the staff says, like, please, in your markets, always put the local people first so that we can make sure that we buy the most from them and then bring the other outside people in that sell maybe the electronics and stuff. So that's what we try and do and to tailor our markets. And then towards the end of last year, there was a lot of chatter among the staff that they also have side hustles that they would like to include in the market. And we heard one of our neighboring competitors does this over in that Odessa place. So we are like, we should probably do this too. So I was like, all right, let's just try it. So the first market, we had 4 employees that tried it out. We sold out one of our vendors who has fried pies. We sold her out in 31 minutes. So she came, she was like, I can't get off work until noon and I'm gonna come at lunch. I was like, okay. Well, she only really had to take her 30-minute lunch because she sold out in that time. She had a line wrapped around. So then it became where, oh, we want you to put the employees, make sure you're always having employees. So we have another market coming up this April. It is the biggest section of employees that we've ever had. I have 9 employees that have signed up to be in it, anywhere from we have someone that sells fishing items that he makes, like lures, to a lot of baked goods. Some people own boutiques. We have all of these different employee vendors, and then the staff get to turn around and they get to go shopping, which has been great because we're helping our own employees, we're stimulating the local economy, and then a portion of that is going back to the hospital to support it. And it's been a huge success. And so now it's like, when's your next market? There's no question. Are you having it? It's when are we having the next market? So it's been great.
Is that open to the public
It
or
is.
you have to work there?
So it is open to the public. So we don't, I would say most of our traffic is the employees, but if there's people there, they usually shop it. And then yes, if you wanted to come to our market, you can come
You can
shopping.
come.
It's open to anyone. So
That's great. That's great. So, Jackie, tell us a little bit about just what it means to you to be in this position where you really are empowering people to do all kinds of good. That's really the goal of this podcast that we have is really just talking to people in the community like you. You're a mom. You're working full time. I'm sure there's a lot of things that play into that stress, the normal, things, making popcorn from ordering, going to market,
mhm.
things like that. But what does it mean for you to really be in a place where you can give back and what it means to you to really see that fruit of your labor?
Right. So I think it gets very down to the basics of working for Midland Memorial. So Midland Memorial has raised me. This is where I'm gonna get emotional. I said I wouldn't. Um, when I was just young, moved here for transplants, like most people here, so many people just took me under their wing and was like, welcome to Midland. I have never lived anywhere with friendly people like this.
Wow.
And we've moved around, and I'm like, we moved all the way back home to Michigan, and I cried every day. And I told my husband, we're going back to Midland, Texas. And he's like, we live in one of the most beautiful places on earth, and you want to go back to the desert. And I was like, "Yes, because you do not find the people anywhere else like you do in Midland." And my husband has now drank the water, the good one, the good water,
The
and
good
he's like,
water.
"I wanna live in Midland forever." Like, to be able to raise our kids here is an honor, and we are 1,400 miles away from anything we've ever known, and to be here for 12 years, just the people you meet that just they don't care where you're from, they just take care of you, and you're a Midlander. The minute you walk through Midland, you're one of Midlanders. You're here to stay forever because people just they it's like nothing else I've ever lived in. And Midland Memorial is a big part of my story. I had my first job. Um, I worked in the foundation, just answering phones. I was a new college grad, and I was like, I don't know what I want to do with my life. And I had the most amazing boss that she just introduced me to the traditions of Midland. She told me the histories of Midland. And I just was like, I think this is where I'm supposed to be. And as our family has grown, we have 3 sons now, and we have them in MISD and just going through all those, challenges that we're all facing as parents, and knowing that we're not alone and that I have this strong community at the hospital. I think that's where the foundation of my joy in my job has been, because I did leave. I was like, "Oh, I'm gonna go try something new." And I remember my boss, Steve Barman, when I was leaving, he goes, "Oh, you'll be back." I'm like, "I don't think so. I think I'm gonna go over here and try this new thing." And then sure enough, I came back and I tell him, and I was like, "I'm here because I don't think it would matter what job you gave me. I'm just so happy to work for this organization because no matter what you're doing in the organization, you can feel the good that you're giving back to the community. And that's what drives me to go to work every day. When I was in the foundation, I was able to work with, the family foundations that gave to the hospital, and just understanding how generous everyone in this town is. That then I got to come work in my current job and see more of the front lines of it, and working with volunteers that give their time. I mean, there's so much to be said about giving your money, but to give your time as well, that is just unmatched anywhere I've ever worked in nonprofits. Is Midland gives like no other that I've ever experienced, and to be able to raise my family in this type of environment, and even stretching out to my husband and his job and everything that they've offered us as a family, we couldn't imagine living anywhere else. So what I get from Midland is so much more than I feel like I could ever give back. So being a part of something as, little or big as it is, I just feel grateful that I can do my part to give back for how much Midland has given to me and my family.
Wow. I love that, Jackie.
I said I wasn't gonna
You're
cry.
gonna make us cry.
I can't
That's
ever say enough good things
I
about
love that.
Midland. And that's actually when I worked for a different organization. They made me the closer because we recruited a lot of people outside of the area. And I could sit and tell people my story and just say, I left and I came back. I mean, I moved across the country twice in 18 months. And that second time around, I was pregnant. Like, that's not fun.
Yeah.
But to want to come back here and to raise my family, I just couldn't imagine raising my family anywhere else.
Yeah.
I think that's the number one thing. I've lived in Midland my entire life, and I think everybody who's lived here their entire life rushes to get out or thinks they're gonna get
Right.
out, and
Yeah.
then somehow it's this vortex and it sucks everybody back in. I am not a fortunate one who's ever gotten out yet. But I think that is the number one thing that you hear over and over and over again about Midland. It's not the beach, it's not the mountains, it's not all this beautiful landscape that we wish we had, but it's the people. And I
It
think you
truly
really
is.
hit that nail on the head, that the people doing
Hmm.
the good work and
Yeah.
people being kind and welcoming other people in. And I love that that you shared that, even the emotional part.
I know. And it's
That's
funny that you say that though, where, people are always like, well, I want to get out or I don't want to live here. And I think once you do get out, you realize you didn't know what you had while you were here, just because everyone um is just so motivated to take care of their own and to figure out how can we be better together. I mean, it's such this it's a community that I think is lost in a lot of other places in America, where it still is so strong in Midland, and you forget that until you live somewhere else and you're like, I want to go back to that.
Yeah, you can visit the beach, you can visit the
Right.
mountains, you can visit all of those
You
places and
can't
all
find a
the
community
that's
like
exactly
Midland.
right. Yeah.
So,
So to live here and
mhm,
visit there,
yeah,
then it's the best of both worlds.
absolutely. Yeah.
Tell us what you think about when you're thinking about just probably what you would want to see if you had a dream. Do you feel like you're living the dream? It sounds like it.
I mean, I am.
I wanted to go down the road of like, okay, what do you think it looks
So one of my
like?
big dreams
Yeah,
for the yeah.
for just what your desire is for the hospital, obviously to give back, not either financially. I think that's another just aspect of what we really want to drive people towards is it's the people, it's getting involved, it's taking that step. And I think I appreciate that about your story about just being willing to dig in. And it means relationships, it means being involved, and so many times we find community in the things that we are a part of.
Mhm.
And so I love that you've shared that with us. But also, what does it look like when you think about where you are and what that next big dream is for the auxiliary, for just where you want to go and what your needs are and how can people be a part of that?
Mhm. So I always joke with my board and I say we're going to be the number one auxiliary in Texas and then we're going to be the number one auxiliary in the nation. I don't even know if they rank auxiliaries, but and they're always like, "Well, I think we already are in Texas." Who knows? But I always say we're going to be the biggest and best auxiliary there ever was.
That's great.
So I think what that looks like to be that it would be to grow our membership. We're sitting at an okay level right now where we're managing, but we could definitely use 20 more people. That would make life a lot easier. So I think growing our membership is a big part of that dream. I think it's thinking more outside the box. You know, these markets have been great. How do we even expand from that? I have a wonderful boss who every year says, you know, you're doing great, but you could do better, which I appreciate that. That's how I grow. So we have a few things up our sleeves this year to see like trying new things. And I love the fact that I have his full support where if it doesn't work out or it might fail, he's always there to support me because that's the type of person he is. So we're trying new things. We think maybe we need to go online with some things. We might need to try different types of markets. All these different things. So I think it's trying new things that maybe have never been done with an auxiliary. It's growing our membership. And just really listening to what the needs are because they're always changing with the hospital. You know, right now it's really they need us at our West campus and how can we get people over there and making it fun and all of that. So it's a combination of all those things, but I think the ultimate dream is for us to be the biggest and best that we can be.
That's awesome.
When you say grow your membership, can you explain what that means? Because I don't know what you mean when you're saying grow
Yeah.
your membership. So
So primarily we need to grow our adult membership volunteers. So, um, it'd be great if I had 20 adults that walked through the door and they were like, "Hey, I would like to volunteer in this capacity for you and have a consistent schedule with you." So I'm very open. Like I tell people, if you want to volunteer with me once a month, that's amazing and I will take you. I'm never going to turn you away. But the volunteers that I get that come in and they're like, I can dedicate one Friday a week or every Friday I can come in and I can work for you. That's when we start gaining momentum on making changes or having the stability that we're in those departments that we're supporting because we have that person that we can count on. So to be who we need to be, I need about 20 adult volunteers who can give me 4 hours of their week and help in the capacity that I need.
so membership is what you call your volunteer
Right, yeah,
base.
so
Okay.
our
Yeah.
membership, yeah. Mhm,
Okay.
yeah.
And we love that just being having the opportunity to talk to you. It's been so fun just to hear about more about what you do. And
Thank you.
if anybody wants to get involved, primary place is they can follow your volunteer link,
Yes.
but also you can find those opportunities on Every Neighbor. And
Mhm,
so we want people to go either both places
yes.
to be able to find those specific opportunities
Mhm.
and sign up.
And I think I always like another great way is to encourage people. It might not be you, but it might be someone you know. So if you have a parent who's recently retired and doesn't really know how they can, you know, fit into the community, come with us. We have tons of retired school teachers, other, you know, they just love it. They're like they find their spot where it's a 4 hour commitment, so it's not too much and you still get to enjoy retirement, but you're a part of something and so it's that socialization that I think when we go into retirement, we somehow forget and need to navigate. But I would think think outside the box when you think maybe it's not me that can volunteer, but maybe it's a family member or a neighbor or something like that.
And you won't make them do bedpans.
Never. Nope.
And no shots.
If I won't do it, I won't ask my volunteers to do it. And no one's letting me do anything medical in that hospital. I get to donate blood once a quarter. That's what I do.
That's awesome. That's
So
awesome.
win-win.
Yeah.
All right. Thanks. Thanks for joining us for Good Work West Texas. And subscribe to our podcast. We'd love to have you listen in on a regular basis. And thanks for being with us.
Thank you.